Good afternoon and welcome to our weekly COVID-19 update for the town of Plymouth. This is number 88. I'm Steve Triffletti, Plymouth Town Moderator. We're here each Wednesday at noon for this update, and it's being brought to you live by PAC TV on Comcast Channel 15, Verizon Channel 47. You can also watch this on PAC TV's streaming channel by going to pactv.org/live. For questions during today's forum, please email plymouthinfo@pactv.org. These forums can be replayed at pactv.org/Plymouth. Today's participants joining Representative Matthew Muratore and me include Dr. Philip Triffletti, Dr. Barry Potvin, also Michelle Bratti, Heather Cozby, Michael Jackman, and Amy Naples. And we're going to begin today's presentation with our welcome from our Plymouth State Representative, Matthew Muratore. Welcome, Matt. Go ahead, Matt, if you can unmute yourself. Not sure if you can hear. We're here with Matt Muratore. Go ahead, Matt.
Am I on? I can't hear Steve at all.
I can hear you, Matt.
You can hear me? Okay, we're going to go then.
Go ahead.
Thanks, Steve. I hope everyone's doing well. The governor just came on to announce, I'm just going to get a quick highlights and I'll come back and do some other stuff. But governor just came on to announce that early educators, teachers, early childhood care workers will begin getting, or at least being able to apply or go online to get the vaccine as of March 11th. The federal program that is run by the feds through the pharmacies like CVS have already started getting appointments. We'll be putting appointments aside for teachers. Now, that doesn't mean this is going to alleviate the problem with vaccines, because the amount of vaccines that we are still getting is still around 130,000 vaccines. Now that we've added teachers, the website is going to be that much more difficult to navigate through for people because we haven't got through the 65-year-olds yet. So, and until we get the supply increase, then we will be able to get vaccines out a lot quicker than what we are. But we are doing a pretty good rate at this point. We actually have 88% of the vaccines that have been shipped to Massachusetts have been distributed as of yesterday. And later on, when I come back, Steve, I'll talk about where we stand in relation to the rest of our counterparts in the country with regards to vaccines. So I'll give some more numbers and all that when I come back on. So back to you, Steve.
Thank you. And then as Plymouth State Representative Matthew Muratore, and he'll be here available to answer your questions. Go to plymouthinfo@pactv.org. And at this time, we're going to begin with our medical segment of our program. And we're going to begin with Dr. Philip Triffletti. He's an attending primary care physician at Beth Israel Deaconess. Welcome, Phil.
Thanks, Steve, for having me on again today, this afternoon. Appreciate being here. Every time I come on, there's the good news and the bad news. So we'll start with the good news, which I'm sure everybody's aware about the new Johnson & Johnson vaccine, which was approved for emergency use authorization on Saturday. So now we have 3 vaccines approved here in the United States, and there's probably actually at least 3 more in the pipeline, so to speak, that could come online later. So we're really doing great with this biotechnology, bringing along the vaccines. The inventory that I've heard about with Johnson & Johnson, I believe they have about 4 million vaccines ready to go. And some of this has already been shipped. And I think you may have seen in the news that a Tufts Medical Center, they were already giving out the Johnson & Johnson vaccine. So we've already been giving some out in this state. And what has been promised now, you heard President Biden's announcement yesterday that we're going to purchase more vaccine from Johnson & Johnson, and that Johnson & Johnson will also be collaborating with Merck under the Defense Production Act. They're going to have 2 Merck plants produce the vaccine that Johnson & Johnson has made. So this collaboration, we're expecting about hopefully 20 million vaccines by the end of the March from Johnson & Johnson, and then 100 million by the end of June. And of course, the big difference with Johnson & Johnson is it's only 1 shot. So 100 million doses means 100 million people are completely vaccinated, unlike the Moderna and the Pfizer vaccine. So, this is really great news, and I hopefully will allay a lot of people's anxiety about, when they'll get their shots and when they'll be protected, because, this whole problem we're having with supply and inventory, in the next couple of months, it's going to be solved. So, I give a lot of credit to the government and the manufacturers, everyone who's had a part in trying to, get these vaccines produced and distributed. But we're on the way. I think the horizon on this is looking very, very positive. Some of the other details about the Johnson & Johnson vaccine, you might have heard, of course, it's easier to store. It doesn't have the freezing requirements of either the Pfizer or the Moderna vaccines. It's a different type of vaccine. The Pfizer Moderna is a messenger RNA vaccine. The Johnson & Johnson is what's called a viral vector. So what they do is they take some DNA and they put it into a harmless virus, and then they inject that into you, and then your body starts to produce the spike proteins, and then your body will make antibodies to the spike proteins. It recognizes the spike proteins as a foreign substance. So, it's sort of tricking our biology, much like the messenger RNA vaccine does the same type of thing, into making antibodies against the virus. The most important thing is you're not getting a virus in your body that is the COVID virus. So, I think for anybody out there that is worried about, having the vaccine because of their risk of infection, you do not get infected from the vaccine. You cannot be infected from the vaccine. Impossible. Another good issue about the Johnson & Johnson vaccine was that it was tested in South Africa, where we have one of the major variants now globally, and was found to be effective against the South Africa vaccine. So, the South African variant. So that's great news. The U.S. vaccines to date distributed, we've distributed 102 million doses nationally, and 70 million doses have been administered, and about 26 million people have received both vaccines, Moderna and Pfizer. So, so that's great news. We keep seeing, increasing percentage of people who, are completely protected now with the vaccine. And we'll continue to see those numbers climb, week by week, month by month. I did go onto the mass.gov website today just to see what is it like to try to order a vaccine, through the website. And unfortunately, everything was booked this morning. But, as they tend to release appointments on Thursdays. So, hopefully you'll see a lot more availability of vaccines that you can sign up for starting tomorrow. But this, the whole issue, it'll take, many weeks probably for the supply to catch up with the demand. So you continue to have some of these frustrations, I'm sure, finding available appointments for the vaccine, but it's really coming around. In the state of Massachusetts, we've given right now 1.8 million vaccines total. There have been 1.2 million vaccines given as a first dose, and we have 565,000 people that have had both vaccines, which I calculate is probably around 8% or so of the population has now had both vaccines in Massachusetts. So, again, progress. We're making great progress. Of course, I think it's worth still talking about this vaccine hesitancy problem. What might happen in the future with different kinds of mandates. I've mentioned before on this program, I believe, in Israel, they vaccinated over 50% of the population. And once they found getting the first doses, it was very difficult once they got to 50% to, find people to continue to get the vaccine. I think you're going to see that same tipping point here in the United States. And so, we're going to have to continue to think about, creative ways of, getting people vaccinated because very soon you'll have probably more supply, than you'll have demand. So I think we're going to reach that, in the coming month or two. And, we'll have to keep working on trying to get everybody vaccinated because, as I've said before, we're certainly all in this together. I sometimes hear people have hesitancy around for young women, issues of fertility or pregnancy. And again, that there's no concerns really for those groups, no reports of trends that are worrisome. So, as far as we know, I mean, we've given this vaccine to millions of people. We're not seeing anybody die of the vaccine, but since we started with the vaccine, certainly we've seen a lot of people die of the infection. So, got to keep pressing ahead, getting people vaccinated. You may have heard in the news they're going to be conducting more tests in children, so that there are some trials underway, I believe, right now for ages 12 to 16, and I think they'll also probably be testing younger children. But hopefully in 2022, we'll have vaccines available for children. But right now, the focus is still going to be on adults. When it comes to mask mandates, I do want to say, it's disappointing to me to see there's several states now that are moving away from mask mandates. I think it's too early to be doing that. And so I'm going to encourage people here in Massachusetts, continue to wear your masks and do all the other things we do to prevent infection. I still feel, being indoors without a mask is probably the highest risk situation. So I think you want to try to, have activities. If they're indoors, you want to be wearing a mask when you do anything indoors around other people. I would say there's a lot of controversy really going on about, whether we should be rolling back, some of the things we've been doing to, reduce the spread of COVID-19. And I think it's controversial here in Massachusetts as well as, throughout the country. And, myself personally, I'm looking more at the medical and the public health implications of, what's going on. I'm not looking at as much at the economic factors, educational factors for the community. So there are other issues to be considered. But I think if you're purely looking at just the medical piece of this, I came up with an analogy today that, if you were fighting a wildfire and, you wanted to put the fire out, you wouldn't just try to put out 90% of the fire and leave 10% of the fire still burning. You try to put out 100% of the fire. And so I think that's the type of thinking we should really have about this. And I tried to find some figures. I think they're hard to come by, but it's my belief that the epidemiologists, they would probably like to see our infection rates in the community down below 1 per 100,000 persons. That would be considered very low rates of community spread, where we wouldn't feel threatened that the virus is going to spread a lot. And I think if you look at numbers like that for the United States, right now we're having about 68,000 infections per day still. And that would mean we would want to get the whole country down to about 3,000 or so infections per day. That's a much, much lower number that we haven't seen since the start of the pandemic. I think if you're looking at those numbers in Massachusetts, right now the 7-day average for infections is over 1,000 per day. In the summertime, we get down below 300 infections per day. If we tried to get to this level of 1 infection per 100,000, that would actually mean to control community transmission, we'd like to have, less than 70 infections in the state of Massachusetts per day. So I think, if you really want to put out the fire, cut down the community spread, that's really what needs to be done. So I'd be curious, I know we're having technical difficulties today, but if Dr. Potvin's able to comment at all on some of those numbers, I'd love to hear his opinion on that. At this point, I'd say listen to medical experts still about, sticking with doing all the mitigation strategies to prevent spread of infection. And, if we keep moving in this direction and get those community spread numbers down, we'll be able to get back to really normal life later this year. So at this point, I'm going to stop my presentation. And again, technicalities permitting, I'm happy to answer questions, later in the broadcast. Thank you very much, Steve.
Thank you, Dr. Philip Triffletti. He's an attending primary care physician at Beth Israel Deaconess. In looking at the gallery, it looks like we're going to now continue with Michelle Bratty. And Michelle is Director of Elder Affairs for the town of Plymouth. Welcome, Michelle. And if you can unmute yourself, Michelle, so we can hear you.
There we go.
There we
See,
go.
I said we
Thanks.
were
Hello.
off our game today, and I speak for
Yes.
myself now.
Yes.
Thank you, Steve, and of course, PAC TV for having me today, and hello to my fellow panelists. As expressed, we continue to be in a situation of less supply than demand, and there have not been any vaccination appointments released right now on the mass.gov websites. It's just difficult to get an appointment, to say the least. The best links for accessing available appointments are on your screen now. Thank you, Melissa, for that. For those of you refreshing your computer pages and continuously seeing no added appointments, this can be very frustrating. I'm speaking specifically to the senior population, but everybody. Please be assured that it is not you. You're not doing anything wrong. You've not somehow missed an appointment opportunity. There have not been many to miss. For those of you without a computer, you can call us at Cal for assistance or dial 211 to speak directly to a booking agent through the state. The state continues to try and streamline and perfect the online system. But understand that as seniors, you are part of the first trial and error rollout and will be the ones who experience the frustrations around technology issues and glitches. We are manning the sites at Cal nonstop and have literally watched the wait time to be allowed into the scheduling queue go from, and I quote, "Your estimated wait time is 15,713 minutes," to "Your estimated wait time is 17 minutes. Have faith. They're working on it. The state will succeed in streamlining this process for you to successfully book a vaccine appointment. And each week, the system will improve. Tomorrow is Thursday, and the expectation is that there will be appointments released at the larger sites such as Gillette, Fenway, Natick, Marshfield, and Dartmouth, as well as the pharmacy and smaller sites. There is a waitlist option on the Skin Esteem Med Spa website, but please know it is quite extensive. Tomorrow's release of appointments will not be done all at once, but periodically throughout the day so that computer crashes are less likely to occur. Please remember, this is a long-distance marathon, not a sprint. There are still more people in need of a vaccine than the number of vaccines. But as Dr. Triffletti explained and pointed out, the supply will eventually equal the demand. Seniors, your phase is based over a 2 to 3 month period time frame. If you do not secure an appointment tomorrow or the next day or next week, just know every new release of appointments brings new opportunities for openings. You are technically supposed to go through the end of April. Although you may be rightfully frustrated with the process of booking a vaccine, remember how far we've come and do not lose sight of the fact that you actually have a vaccine in your future. We will all get our appointments in due time because we all have the same goal: good health and appreciation for our time with each other. Meanwhile, our world is slowly opening, and as we enter phase 4 of the reopening state plan, so in between hitting the appointment refresh button on your computer, I want our seniors to focus on engaging with those around you and enjoying Cal's lineup of entertainment, all from the comfort of your home. On Monday, March 8th, we are presenting award-winning singer and storyteller Davis Bates in a live Zoom celebratory Valentine's Day in March performance. Also live on Zoom, we are so proud to present Brennan's Brigade for a fabulous afternoon of fun and music celebrating St. Patty's Day. They're an awesome band. For registration is required for both of these events, so please call Cal at 508-830-4230 to register. Spring is truly right around the corner, and we will be celebrating baseball's opening day with a special grab and go honoring this favorite pastime, along with raffle opportunities. So stay tuned for details. Thank you so much, Steve.
Thank you. And that's Michelle Bratty. She is Director of Elder Affairs for the town of Plymouth. Please send your questions to plymouthinfo@pactv.org. And now we're going to return to Dr. Barry Potvin. He is the chair of the Board of Health for the town of Plymouth, and he's also Professor Emeritus for Yeshiva University in the Department of Biology. Welcome, Dr. Potvin.
Yes, thank you, Steve. Sorry about the internet failure. Just at the wrong time, all of a sudden, everything went blank. Kind of disturbing. So what I thought I'd do to make things go quickly is I'm going to try to screen share a prepared PowerPoint presentation for you. And hopefully this will go well. Can everyone see this, I hope?
Yes, we can.
Okay, Okay, so just very quickly, down at the very bottom, you see the data that's used to calculate whether we're red, high risk, or lower risk. This came out on the 25th of February. There'll be a new one tomorrow. You can see that this number 26.8 is important, and so is the 4.25. So when the new numbers come out, if the 26.8 goes below 10 or the 4.25 goes below 4, then Plymouth will no longer be considered high risk red and it'll go down to yellow. This is what we saw last week also at the same time. You can see again, this graph shows a consistent decrease in those numbers. This is what was going on with the state. You can see that as of the 25th last week, there were still 28 high risk red communities. Plymouth was one of them. And then just to give you some quick ideas, I know this has been covered a little bit, but these are the number of cases and deaths in the US, in Massachusetts, and in Plymouth. You can see that of those who are diagnosed with COVID, 1.8% or so died in the US, 2.87% or so died in Massachusetts, and we had 145 deaths, 3.81% of those that were diagnosed with COVID here in Plymouth. There was an indication also from the CDC that the 65 to 74 age group perishes of this infection at 90 times the rate of those between 18 and 29. So that's one of the reasons that that group was prioritized. I'm going to skip through some of this because I think Matt already talked about it. But down at the bottom, you notice that this new group of educators, childcare workers, and school staff that are going to be able to sign up for appointments on Thursday, the 11th, adds about 400,000 individuals to the group. So now the group that are eligible trying to sign up will be 1.4 million. And Matt already mentioned that the pharmacies are already allowing the educators to sign up. As of February 23rd, 73.5% of those 75 plus had received at least one dose of vaccine, and about 14.6% of those between 65 and 74 had also received one dose. This is still not changed. This is the various places locally where you can still get appointments and hopefully receive vaccinations. Just a little hint to those of you who have been struggling with the state website and are really getting tired of sitting there for hours watching the wait time go from 2 or 3 minutes back up to more than 1 day. Please try again tomorrow. The CVS system is the CVS system. It does not operate through the state PrEP mod system. And if you go to that one, you'll find a listing for states. You click on Massachusetts, it'll immediately show you all the locations of CVS pharmacies that are giving COVID vaccine. And it'll show you which ones, if any, have openings. And unlike the state system, they seem to add appointments on a regular basis almost every night, sometime between midnight and about 7 in the morning. So my wife succeeded in getting me an appointment. I got my first shot yesterday down in New Bedford, and she got herself an appointment in West Bridgewater coming up Sunday. So that works a lot better than the state system. Quite frankly, also, those of you who are educators and just became eligible on the 11th, you're going to be eligible to go into the CVS system immediately. And it would be probably a good idea to try as soon as you can. The B.I.D. Plymouth Colony Place, I just noticed they are now sending out appointment notices to people again. They just got their vaccine supply restored. The Kingston Collection Mall is still ongoing struggle. It's before the state, and there was a huge meeting yesterday involving an awful lot of town managers. Major problem that we confronted really is just financial. I don't think anybody's ever shown this, so I thought I would, so everybody could see what's going on. This is done again every Thursday, and you notice that doses administered as of the 23rd of February, there's a lot more females than males. So it's 653,000 or so females and just 278,000 or so, or sorry, 395,000 males. And that corresponds to the percentages you see below. This is also important because it shows you the progress that we've made. So far here in Massachusetts, it shows the first doses, which are the most important because those are the people who have gotten at least one dose. There's among 75 plus, what about 330,000? I can't see the whole number on the screen here. That corresponds to the percentage you already saw. We thought about 450,000 people were in that age group trying to get vaccine appointments. And this is the group in the 50 to 60, in the 65 to 74 year age. And those are now around 14.6% that have been vaccinated with at least one dose. This is some information that I know, I guess Heather was going to go through this, but I got additional information on the DPH webinar by asking specific questions in that chat box. So just to quickly run through it, indoor performance venues are going to be allowed to open at 50% capacity, but no more than 500 people. I'll skip through some of these others. Down at the bottom, restaurants no longer have a capacity limit. They can host musical performances as long as it is without singing. They don't like wind instruments to be used. If at all possible, should be avoided. There's still a 6-foot social distancing limit. There's still 6 people per table limit. There's still bar seating restrictions in place, and there's still a 90-minute dining limit once you're seated at the table. Also, for those giving performances, individual performances have to stay separated from each other by 10 feet, and they have to be 25 feet away from the customers. So again, this is something which is up to the individual cities and towns to accept or postpone. And so far, I think only Boston and probably Somerville have elected to postpone it. This is going to be phase 4. It's going to start possibly on March 22nd. There's going to be a lot of other things changing. I'm not going to go through them now because I don't want to take the time. We can do it again when it's closer to March 22nd. This is just to remind everybody, yes, we still have to wear masks, unless you're down in Texas and I think Louisiana or Mississippi, where they just decided to do away with it. They also took away all their safety precautions in those 2 states. So it's everybody for themselves and good luck to them. But if you do wear masks, double masks are very useful. So I'm going to stop there and stop the screen share. So I hope I didn't take too much time. I did my best to get through a lot of information. There'll be a lot more information offered, obviously, at the Board of Health meeting coming up a week from Wednesday.
Thank you. And that's
Thanks,
Dr.
Steve.
Barry Potvin. He'll be available to answer your questions. Please send them to PlymouthInfo@pactv.org. And at this time, we welcome back Heather Cozby. She is a CPA in Plymouth. Welcome, Heather.
Thank you very much, Steve. I'm glad to be back. It's March 3rd and officially 12 days from the first deadline of this tax season. It's an important deadline. It's called the pass-through entity deadline, or your partnership or S corporation. And that leads right into the first topic I'm going to go into, which, with all the discussion of PPP activities related to loan forgiveness and whatnot, there's a very, very important Massachusetts-specific issue that we need to go over. So I've not said a lot about it in the past because I was kind of hoping it would be corrected by now. So this is the issue in Massachusetts. We all know federally, if you get your PPP loan forgiven, it's not going to be income. You're not going to be taxed on it. Massachusetts has a split decision on that issue, let's just say. So depending on how you're taxed as a business in Massachusetts, you may have your forgiveness taxed or you may not have it taxed. And just to dig down into that a little bit, if you are a C corporation, so you're a corporate entity that pays its taxes at the corporate level, and these are usually larger businesses. Right now, if your loan has been forgiven for 2020, you will not pay taxes on that loan forgiveness. For every other small business that pays taxes on their personal return, and this would be an S corporation where the income's reported on the owner's return, a partnership where again it's reported on the owner's return, a sole proprietor, a 1099 worker. If your business income is being subjected to personal tax law, that loan forgiveness is taxable at 5%. So if you have a loan that was $100,000, you're going to pay $5,000 in Massachusetts tax if it was forgiven in 2020. So that is the biggest issue right now facing businesses. And if your loan has not been forgiven, then it's going to be a 2021 issue for you. There has been a lot of discussion at the state level. I was talking with Representative Muratore before the meeting to get some information on this. And they are discussing trying to figure out how to resolve this for the taxpayers in Massachusetts. At the end of the day, it's just blatantly not fair that if you have two businesses next to each other in a storefront, that one person's forgiveness is taxable and one person's is not, depending on their entity structure. So hopefully at some point this year, there'll be some resolution. So at the end of the day, if you got your loan forgiven for 2020 and you are part of the group that would be taxed, my recommendations would be to file an extension for the March 15th deadline, file an extension for your personal return, assuming worst case scenario that it's going to be taxable, then wait and see what laws get passed so that you don't have to then amend a return should you be able to go back to correct this issue in the future. So that is the most important thing facing our business owners most small businesses are taxed in the manner that is being affected by this. So that is something I wanted to make sure we went over. The general PPP information is banks are having their one-page applications available for small businesses to work on that forgiveness for this year. So that's great news. Banks are moving forward with getting that prepared. That's going to be the easiest way for anybody with loans under $150,000 to get their loan forgiven. A general reminder, if you are eligible for round 2 of PPP funding, that has to be done by March 31st, pending any extension given in legislation that's right now in Congress. So again, know that even if your revenue didn't decline 25% in the year on an annual basis, if you can prove your revenue declined in a quarter, so quarter 2 of 2020 versus quarter 2 of 2019, if you had a 25% decline, you qualify for a loan. And that loan will more than likely be forgiven as long as you continue to use the funds appropriately for payroll, rent, and those qualified expenses. So that is that general update. I know that Mr. Jackman is going to talk about the pending stimulus package in Congress. You know, there's economic impact payments. I just wanted to point out that one of the nice changes that's being considered is that if you have college-age children, so adult children, those children could qualify potentially with this law passes to receive the payment, where in the past those children have not been able to qualify you for a payment. So that would be very good and helpful information for everybody moving forward. There's a lot of information in this about the pending eviction moratorium. So right now you can't do evictions through March 31st. That's obviously an issue. There's funds in that bill to deal with helping homeowners pay back those outstanding rent payments. There's a lot of information. Of course, you know, we're probably a good week out from it being signed. They're trying to have it signed by March 14th, pending the Senate voting this Friday. And like I said, I know Mr. Jackson is going to go into a lot of more of those details, but that's what's going on. But I wanted to bring it up because a lot of discussion, a lot of anxiety is around the ability for the IRS to actually function properly right now. They have almost 7 million tax returns from 2019 they have not processed. They had a 3-week delay in starting this season, and they are being adamant about not extending the April 15th deadline, despite all of the environmental conditions existing for all taxpayers, practitioners. I mean, for example, practitioners have the collateral damage of, you know, I have my son who homeschools in my office 3 days a week. That'll be improving at the end of March, but that only helps me for 2 weeks of the season. So right now, I believe the IRS will be silent until this law is passed by Congress. And at that point, hopefully we will hear. They have 12 days, though, to make this effective for the March 15th deadline. So I expect there to be a lot of information coming out on the federal level in the next week or two, and hopefully some information in the next month or two from the state that will be affecting your 2020 season. So continue to be patient and know that, you know, everybody's just trying to work together to make this happen and get everybody their refunds. So thank you very much, Steve.
To CPA with the town of Plymouth, and you can send questions to PlymouthInfo@pactv.org. And as she mentioned, we're now going to be going to Michael Jackman. He is the district director for our Congressman, William Keating. Welcome, Michael.
Thank you, Steve, and thank you as always to you and to PAC TV for having me on. As Heather mentioned, the big highlight from our office today is the American Rescue Act, which the House did pass last week. There are a lot of moving parts and a lot that we're still waiting to see. First and foremost, the Senate has to pass it, which we expect will happen this week, and the president needs to sign it, which we do expect will happen within a week. As Heather mentioned, that March 14th unemployment deadline is looming, when folks who are currently receiving unemployment benefits will lose the federal extension and the federal stipend. And the pandemic unemployment for independent contractors will also expire if there's no action taken on this legislation. So with that sort of deadline looming, we are pretty confident that the bill will pass and that it will be signed into law. So that's one big feature of it, is the unemployment issue. We do think it's important that folks who are still struggling as the economy slowly reopens, that people have that support. So that's why it's such important that that's in there. One of the other highlights as well is, as Heather alluded to, is the economic impact payment, which will be the $1,400 round 3, I guess you'd call it, of economic impact payments. We had round 1, which was $1,200. We had round 2 just last month, really, January, which was $600. And this $1,400 is like a complementary to that, to make the entire round 2 payment $2,000. And there are some changes in eligibility, as Heather alluded to, for dependents. And one of our questions is, we did have some folks who were not able to get the round 2 payment for the $600 because they had not filed a 2019 return, or had not had their 2019 return processed because they filed on paper, and their return had not been processed in a timely fashion because of the pandemic and the big processing centers being closed. So we're going to be working very closely with the IRS on that to find out how people can make sure that they're eligible for that. Currently, if folks did not get the $600 round 2 payment, they can claim, or the $1,200 payment for that matter, they can claim the recovery rebate credit, which is what we are advising people to do based on the guidance we're getting from the IRS. Also, there's a lot of funding in there for helping schools to reopen. There's a lot of funding in there for vaccination programs, setting up direct federal sites similar to the federal program for the CVSs to vaccinate teachers. This bill will have funding for more vaccine programs like that. We hope that as Dr. Phil and Dr. Potvin both alluded to, as more vaccine becomes available, there will be more vaccination appointments and more opportunities to have these additional sites federally as well as a state program. So we're looking forward to that. And one thing I wanted to point out specifically for Plymouth is that this Rescue Act does include an allocation, an appropriation of $350 billion for state, local, and county governments. And the intent of this is to help those states and towns recover from revenue that they lost during the pandemic. And that affects all of us. That affects the services that towns are able to provide, services that the state's able to provide, and makes the job a lot easier to balance those budgets, whether it's at the state level or the local level. And if the bill is passed as the House passed it, the town of Plymouth would be eligible for an award of over $9.6 million. So that's a big chunk of money that can help the town look at the needs and balance the budget. And as in the CARES Act back in March of 2020, there will be an allocation for counties. And Plymouth County, because it represents over 500,000 people, would be eligible to claim that. And if they choose to do that, it would be over $101 million, which I know has been a big help for some of our local municipalities, making physical changes, making upgrades to physical plant, to bring schools back, to bring town offices back, town services back. And we're really looking forward to these bills passing so that these funds can be put in effect. So that's the big highlight. I know there's a lot of moving parts to this. Heather mentioned a few that affect her and her work, but this is a big bill and it's going to affect all of our work. So hopefully as the bill is passed, we'll have more information to share with you. Thank you, Steve.
Thank you, Michael Jackman, District Director, Congressman William Keating. We're now going to move to our business segment. We welcome back Amy Naples. She is Executive Director of Plymouth Area Chamber of Commerce. Welcome, Amy.
Good afternoon, Steve. Always a pleasure to be here. Awesome updates from all of the panelists. It's such a wealth of information I learned from each one of you, and I'm thankful for the effort you put into these reports, as well as your hard work each and every day, helping out our small businesses, our residents, so many people. So thank you. The Plymouth Area Chamber team remains quite busy, and with the vaccine rollouts, the governor's announcement last week, and spring in the air, we are excited, optimistic, and planning for the warmer months ahead, which include critical recovery efforts. As Barry reported, Massachusetts will continue to relax restrictions on business operations, and as of March 1st, have returned to phase 3, step 2, and businesses are celebrating that. This is all promising news and encouraging for our local businesses. And although it is promising and very positive, we still need your help. Our small business community really needs your help. And the Chamber has created ways that you as a community can help support our local small businesses. For example, we do have our local Eats Week coming up March 19th through the 26th. Participating restaurants will offer exclusive deals and special menu items for $20.21. In addition to restaurants, we're encouraging all food establishments to be a part of the promotion. So that includes our local candy stores, bakeries, breweries, takeout restaurants that only serve takeout, and of course our dine-in restaurants. So the list continues to grow daily. And you can view all of our participating restaurants on the localeatsweek.com website. And it's a really great website, and you can access which participating restaurants are and kind of plan out your week and where you're going to visit. Another opportunity to support our small businesses is to join us for the next Cash Mob on March 17th at 2 to 4 p.m. And for those of you who aren't familiar with our cash mobs, it's basically a group of people assembling at a local business to make a purchase and support them. It's as simple and easy as that. Not only does it bring a register, but it also allows a little exposure for the business. And some people may not be aware of what that business has or sells. During the COVID times, our rules have changed a little bit, and there's a longer window to mob a business. We also inform the business before we announce where we're going. And prior to COVID, it was a surprise. So attendees register at plymouthchamber.com. We reveal the location 48 hours before the cash mob. We ask that you stop in between 2 and 4 on March 17th. We encourage you to bring coworkers, friends, family. Honestly, the entire community is encouraged to participate and bring $5 to $10 in cash to spend at that local participating business. So we're excited for that. March 17th. And lastly, we will be having a morning mixer virtual networking meeting on March 10th at 10 a.m. It's a great opportunity to network. We are going to have breakout rooms and trivia. So join us for coffee and great conversation. And my final update I wanted to share was regarding the Rocklin Trust Small Business Big Dreams contest that they just announced a few days ago. Each year they do this contest and it provides small businesses in our community a chance to win $20,000 to help grow their business. I thought it was definitely important for me to share that today because we know that small businesses could use all of the financial help that they can get right now. Entries are accepted between March 1st and April 1st. And for more information, you can certainly go to rocklandtrust.com. And of course, to stay up to date on all chamber news, feel free to visit plymouthchamber.com and of course, follow us on Facebook and Instagram. Thank you, Steve, as always, for allowing me to provide the business update.
Thank you, Amy Naples, Executive Director, Plymouth Area Chamber of Commerce. We're now going to go to Plymouth Representative Matthew Muratore. Matt, you began the program, but you have more to share with us.
Yeah, a lot more to share, Steve. It's been a busy week already. I had my first hearing for the state budget yesterday, which went for a few hours. Had a meeting with the governor, lieutenant governor. We also met with Secretary Sutters as well, all obviously through Zoom. But a lot of things coming out of those that I want to share with everyone. First of all, I know Dr. Potvin actually talked about the Kingston collection. We did confirm that Kingston collection is one of 18 regional collaboratives that are being looked at by the state. So it was acknowledged too that this is an area that is an open area. And if we can figure out, as Dr. Potvin said, the financials of this and how to do that, then I'm pretty confident, I think we're all confident as a delegation that this will happen. With regard to the reopening, I know there's been some discussion about, reopening, are we doing it too quickly or, some people say not quickly enough. All this, I want to make sure it's very crystal clear with people. This is based on data. It's based on health data. It's not based on economics. So the health data is what's driving to us to go back to phase 3, step 2, which we were in before the holidays. And then everything exploded, so we came back. But that doesn't mean that can't change. If things change and things get worse, we will go back again. So if you look at the actual percentage of the 7-day positivity rate, it's 1.82%. And we haven't seen that since the fall, since around October. So it was appropriate in my estimation, by looking at the health data, not the economic data, but the health data, that this was an appropriate move to do. And again, it's always reviewed by the health experts and the Governor's Council. So we'll continue to keep an eye on that. In addition, we are looking at, as a state, to extend outdoor dining on a permanent basis. That's one of the things we talked about at our hearing yesterday, to allow for permanent dining from April 1st to October 31st. So that's just in the early stages, but I wanted to make sure that our viewers knew that that's something that is being looked at statewide. Another interesting thing came out is unemployment. As I know, Mike Jackman has been so helpful with this, with our office. There's so many people that file for unemployment, as we know. But if you look at the average year of unemployment in the Commonwealth and you look at just the dollars, what we paid out in 2020 is 15 years worth of unemployment. 15 years worth of unemployment in 1 year was paid out. So that has to be paid somehow. And we are working very hard not to put that unemployment rate on the small businesses or any businesses. So we are looking, the governor was talking about doing some bonds to pay this back at low interest rates. But that's something that I want small businesses to know that we are actively working on and ensuring that doesn't come back on you, because that's a big bill for any business that's going to have to pay. In addition, Heather did talk about the PPP and the 5%. It's something that Secretary Heffernan from Finance, Secretary of Finance yesterday talked about the fairness of that, as Heather said. we really need to look at how to make this fair and not charge people that 5% tax. So we are looking at that. The website obviously is still an issue, and a lot of it has to do with the supply and demand. There's just not a lot there. And as Dr. Potvin indicated, now that we're going to be adding teachers to this, we're going to be looking at 1.3 or 1.4 million people looking for 130,000 vaccines next week. So it is going to take a few more weeks. We were probably about 2 or 3 weeks away from getting teachers into the queue anyway. So I don't think it's really putting too much pressure on it, but it does add a little bit to that. Again, with more vaccines coming, we thought J&J, the Johnson & Johnson vaccines, we were going to be getting more. What they originally announced that they really didn't have. So it's a lot less. We're actually getting 58,000 from Johnson & Johnson this week of vaccines, and that's it. Next time we can put an order in is March 25th. So hoping with Merck, working with them, that we'll actually get more of a supply by early April. There are also, as I indicated, there is indication that there's 170 sites at this point that are available to give vaccines. So with adding another 18 or 20 more regional collaboratives, we do feel that we are quite ready for the large influx of vaccines that will be coming at some point in the very near future. Just some quick stats too. Massachusetts has been ranked #1 for first doses administered per capita among states with over 5 million people, and we are ranked 12th for total doses per capita in the nation as well. So we are at, and I think I said earlier that we are at 88% of those vaccines distributed. And what's interesting is when you look at and we've been doing this just about a year now, Steve, and when you look at the total cases of COVID now, we're at 551,000 cases of COVID. We've tested 16 million people. Hospitalizations have dropped to 775. When you look at the amount of COVID cases that we've had, which is 551,000, and you look at the vaccines that we have given so far, we're just about even at this point at 565. So we are now turning the curve where we are actually having more vaccines in people's arms than we do have COVID cases. So that's a nice thing to see. And as we continue to get more vaccines, as we continue to work on the website to make it a little bit more simpler for people, we will be in a better state as a country, as a state, as a country, as a town. And as the president said yesterday, that the goal is to have more than enough vaccines in the states by the end of May to get these out. So we are in a great position as a Commonwealth that when we do get all these vaccines, we're going to be getting them out as quickly as possible. Right now, we are doing 44,000 vaccines a day, but we feel we can more than triple or quadruple that if the vaccines are available with the sites that we currently have. So that's the rest of the update for today, Steve.
Thank you, and that's Plymouth State Representative Matthew Muratore. We're now going to go back through our panel with questions and closing statements. We're going to begin with Dr. Philip Triffletti. Dr. Phil, Dr. Potvin showed a photo of what appeared to be Dr. Fauci double masking. And the question for you is, does it matter how you put on the double masks? It looked like he had an N95 mask underneath with a cloth mask. Some people also have these light blue masks. What would be the best way, particularly for somebody flying on an airplane?
Great question, Steve. So the double masking, I believe that you saw on the Dr. Fauci photograph was a blue surgical mask, which was underneath a cloth mask as a double mask. So that they prefer you wear the cloth mask over the surgical mask. And, there's some data that indicates that combination of those two types of masks is extremely effective at preventing transmission. I do think that if you're flying, that'd be a great option for, what to wear if you're in a commercial airline flight. The commercial airline flights, by the way, I think, I've looked at that data a few times. they have done a lot with air exchange and other engineering things to really make it very safe to fly. So I don't think we've seen a big spike in problems with people flying. And of course, one of the bigger concerns really is what happens in the terminal in terms of your close proximity to others. If you're in a TSA line, you're in a ticket line. So I do feel that flying is probably a safe endeavor, and I do endorse that the double masking is probably superior to using a single mask.
And Dr. Phil, what's your takeaway today?
Well, I use the analogy of we're fighting a wildfire, forest fire, and we used to say only you can prevent forest fires was the tagline for that. And I think for COVID-19, we should think of it in the same way. Only you can prevent the spread of COVID-19 infection. So I think all of us doing our part, getting our vaccines, wearing masks, even if you've been vaccinated, which we can touch upon on a future broadcast, continue to do all those things. And we've got to get those community spread numbers, way down. And then I think we'll go back to normal later this year. Thanks, Steve.
Thank you, Dr. Philip Triffletti, and attending primary care physician Beth Israel Deaconess. We're now going back to Dr. Barry Potvin. He is chair of the Plymouth Board of Health. Barry, a lot of information again today. What should we remember?
Well, there's a couple of other things that probably everybody should be aware of. One is that the CVS pharmacies do not get their supply from Massachusetts Supply. It comes directly from the federal government. And CVS doesn't seem to be having the issues that the state does in terms of keeping adequate supplies of vaccine coming in. When I was there yesterday, they had people coming in one after the other, and they generated an awful lot of vaccinations in a fairly short period of time. The only experience I had was a slight soreness in my arm at the site of injection. Otherwise, it was fine. So please remember, everybody, that you just have to hang in there, I think, for another maybe 3 to 4 months. We have to get into the summer. And the best way to do that, in addition to getting the vaccine, as everybody says, is keep wearing masks. Keep your physical distance, especially from people who are in an indoor setting, who may or may not be wearing masks if they're eating or dining. And just be cautious. So, if you can do all these things and you try to stick with people from your household or people have already been fully vaccinated, it'll go a long ways to getting us out of this so that we can go back to our normal lives. So just hang in there for a little while longer. We can get there. Thanks, Steve.
Thank you, Dr. Barry Potvin. He's Professor Emeritus, Yeshiva University. He's an epidemiologist. We're now going to go back to Michelle Bratty, Director of Elder Affairs. Michelle, what is your closing statement today for our seniors?
Sure. It echoes what everyone else is saying. I can't produce a vaccine for you here at the Center for Active Living, a physical vaccine, but you know what we can do? We can reassure you, we can listen, we can help you with your frustration. If you just want to talk, if you just want to vent, if you just want a reassurance that you're on the right path and it is going to happen, that's what we're here for. So I'll leave you with a little quote. Hope is like the sun, which, as we journey towards it, casts the shadow of our burden behind us. That is where we're heading, Plymouth. Samuel smiles. Have a great day.
Thank you, Michelle Bratty, Director of Elder Affairs, Town of Plymouth. Heather Cozby, you've provided us with a lot of information. It looks like we're going to have to be on our toes for the coming weeks with changes in the law.
Yes, that is correct. Lots of stuff coming up. I became an accountant because I don't necessarily like change. So this has been an exciting year for me. I enjoy same old boring financial stuff over and over. So, definitely continue to be patient. I just wanted to highlight one other thing for our nonprofits. In the pending bill at Congress, there is some expansion of the PPP money for our small nonprofits. So that I wanted to bring up. We are so lucky here in Plymouth to have an amazing culture supported by so many nonprofits that, there's been so much discussion about the restaurants and supporting the restaurants. But I do want to remind people as we start opening up this spring, whether or not it's a concert at Memorial Hall or whatever we can do to also look at the culture in Plymouth that brings our tourism in, the museums, everything. It's just amazing what we have here. And I'm looking forward to this summer with all these wonderful nonprofits and the businesses supporting them, the restaurants, the stores, everything getting back into shape and really recovering and having a wonderful 400th celebration this year. So thanks.
Thank you, Heather Cozby. She's a CPA in Plymouth, and we're now going to go to Michael Jackman. Michael, Congressman Keating has been busy, and it looks like he'll continue to be busy.
Yeah, there's definitely a lot going on down in DC, and this Rescue Act is the biggest piece and something we're all looking forward to. As always, I'm always impressed by everyone on this call and the great information. Thank you, Barry, for sharing those slides. I think that's really important information to show the progress and where we've come over the last few months with COVID, now that vaccinations are starting to happen. I was kidding with Michelle. I'm going to send all my calls to her because I think she has a great attitude and a great way of approaching this, but I think that's the right approach. And it's urging people to be patient, to persevere. I've said it a few times on this call. There is a light at the end of the tunnel, but we are still in the tunnel. But we got to keep, moving towards that light, and that's all going to be an effort of working together and making sure that we're keeping each other safe and healthy and supporting each other as much as we can. So thank you very much.
Thank you, Michael Jackman. District Director, Congressman William Keating. Amy Naples, our businesses can look forward. Next week, certainly the weather forecast is for some very almost summer-like weather.
Yes, we love when we have good spring weather, summer weather. I think Heather said it best. We have so much to offer here in Plymouth, and we are so fortunate of not only our small businesses, but our arts and culture and the nonprofits. And I cannot wait to see the vibrant seasons ahead for our community. And we know that those days are certainly ahead of us. I think a great takeaway for today is certainly hang in there. There are better days ahead, and we know that those are so close to us, and just hanging in there is all we need to do. As always, the Chamber is here to help any business, members, non-members. Please don't hesitate to reach out and give us a call at 508-830-1620. We're here to help anyone and everyone we can. Thank you.
Thank you, Amy Naples, Executive Director, Plymouth Area Chamber of Commerce. We'd like to thank all of our panelists, including Dr. Philip Triffletti, Dr. Barry Potvin, Michelle Bratty, Heather Cozby, Michael Jackman. And next week, we're going to be joined once again by Ken Tavares, Chair of Select Board. He's not here today. He's at Gillette Stadium. He's getting his second vaccine. He'll be joined by Dr. Mark Wilson, Sarah Cloud, Karen Keene, Dr. Christopher Campbell, Cheryl Botieri, and Stephen Cole. At this time, we're going to return back to where we began with Plymouth State Representative Matthew Muratore for closing thoughts. Matt.
You know, I almost wasn't going to be here either. I offered Ken to bring him to Gillette for a ride so I could help him out, but maybe get a second shot myself, but couldn't do it. So anyways, just one other thing that I wanted to highlight too, for my long-term care friends, 90% of those that live in long-term care facilities, nursing homes, assisted livings, and rest homes have been vaccinated with 2 shots at this point. So that's great news, since 60% of those deaths all came from long-term care facilities, and 70% of the staff have now been vaccinated as well. So that was some good news. Also, Steve, we just got some information just in from the governor's office with regard to the teachers and vaccines. So as we indicated, the teachers, as Dr. Potvin indicated, will add another 400,000 to the group of people that are looking for vaccinations. So it's now estimated to be about a month now for everyone in this group of 65 plus and teachers to get the vaccine. So patience is a virtue, and that's a great thing that Michelle is telling people. And the other issue will be that tomorrow, because we are now, we've been vaccinating people for almost a little over a month now. Now we're starting to see the second doses, but we're still getting the same supply. We're still getting around 130,000, 140,000. So most of the supply that we get tomorrow for this coming week will be for second doses, which means those appointments for first doses is only going to be, pay attention, Michelle, 12,000 people. So only 12,000 people are going to get first doses. So people just need to be patient, keep persevering, And as Walt Whitman said, be curious and not judgmental. And we'll see you next week, Steve.
Thank you, and that is Plymouth State Representative Matthew Muratore, and we will be here next week on Wednesday at noon. I want to thank PAC TV for their generous support of all of our updates. I'm Steve Triffletti, Plymouth Town Moderator. Thank you and good day.